Presently, there's over 6,000 people across the state waiting on home care support, and it's an unacceptable situation. I mean, the crisis is getting worse and worse. In October 2021, 4,825 people were awaiting home care. In July this year, 5,312, and now it's at 6,255, according to a recent parliamentary question I submitted. I mean, we've been warning as a party about this for a number of years, of a looming crisis within the home care system. And in responses to parliamentary questions I submitted, the government acknowledged that demand for home care support has grown considerably over the last number of years, and that factors such as the contracts of employment and offer and employment terms and conditions being offered are a factor in the recruitment challenges faced by the sector. So if you know what the challenges are, why aren't they being addressed? And also, the HSE are employing over 1,000 fewer home care assistants now than they were in 2017. So Fianna Fáil and Fine Gael have failed to plan for proper home care to look after those in need. And what's happening is this failure is pushing older people into hospitals and nursing homes when they should be cared for in their own home. The lack of community care alternatives has left thousands in hospitals. And some could have early release from hospital, but they can't because they've nowhere to go when they go home. They've no one to look after them. Maybe they live alone, or they live with an elderly spouse or sibling. So what we need is a pay agreement for the sector, and the government needs to make this happen. So we need a proactive strategic approach to workforce planning across health and social care. And the government must advance vital regulation for the home care sector and should make this legislation a priority, and it must establish the promised Commission on Care to kick-start the modernisation of social care arrangements. I want to also raise the home care cash grant, Minister, with you again, because I raised this in questions and promises legislation a few weeks ago. Well, this is placed the entire onus on older people or their spouses to advertise for carers, to recruit them, to ensure they're adequately trained, to ensure that all aspects of the employee's entitlements are adhered to, such as PAYE leave and work permits where applicable, and include this on their home insurance. Now, you suggested that day that I was confusing this with the personalised budgets. I assure you I am not. There is a home care cash grant. I sent you information on this after that QPL session. I'm awaiting a reply. It shows exactly with the correspondence from the HSE to the person in question, with their permission, of course, and it's referred to as the home care cash grant. It is used by the HSE in some areas, and it's not appropriate, it's not fair on the older people, it's actually dangerous, and I've outlined the whole thing, and I'd love a response to it, please.
Deputy Martin Brown.